Health insurance pre-authorization means the insurer wants to review certain care before it happens. The doctor may recommend a test, procedure, medication, or treatment, but the insurer may require approval first. Without that approval, the claim may be delayed, reduced, or denied depending on the plan rules. The purpose is cost and medical review. Insurers use pre-authorization to check whether a service appears medically necessary, whether it fits policy rules, and whether a lower cost option should be tried first. Patients often experience it as paperwork, but for insurers it is a control point before large spending. Pre-authorization is common for advanced imaging, planned surgeries, specialty drugs, hospital admissions, physical therapy, and certain medical equipment. A basic doctor visit may not require it, while an MRI or biologic medication might. The exact list depends on the insurance plan. The process usually starts with the provider. The Doctora Euro's office sends clinical notes, diagnosis codes, test results, and the requested service to the insurer. The insurer reviews the information and sends approval, denial, or a request for more details. Delays often happen when documentation is incomplete. Approval does not always mean the patient owes nothing. It means the insurer agrees the service meets pre-authorization requirements. Deductibles, copays, coinsurance, network rules, and benefit limits can still apply. Many patients confuse approval with full payment, and that misunderstanding can lead to surprise bills. A denial does not always mean the care is useless. It may mean the insurer did not receive enough information, wants a different treatment tried first, believes criteria were not met, or considers the service outside the plan rules. The reason code or denial letter matters because it points to the next step. Step therapy is one common requirement. The insurer may require a patient to try a cheaper or more standard medication before approving a more expensive one. This can be frustrating when a doctor believes the advanced option is better. The appeal usually needs medical reasons why the first step is unsuitable. Pre-authorization can expire. Approval may be valid for a specific time window, provider, facility, dose, or number of visits. If surgery is delayed or therapy continues longer than expected, a new approval may be required. Patients should not assume one approval lasts forever. Emergency care is different in many plans. True emergencies may not require pre-authorization before treatment because delay could be dangerous. But after stabilization, hospital stays, transfers, or follow-up care may involve review. The emergency exception does not mean every related bill is automatically simple. Patients can protect themselves by asking direct questions before scheduled care. Does this service need pre-authorization? Has it been approved? What approval number was issued? Which provider and facility are listed? Is the approval still valid on the treatment date? These details can prevent avoidable billing problems. Providers also make mistakes. A clinic may forget to submit the request, submit the wrong code, send it to the wrong insurer, or assume approval is not needed. The patient should not have to manage every detail, but a quick confirmation before expensive care can save weeks of frustration. The insurer may approve a different level of care. For example, it may approve outpatient treatment but not inpatient admission. It may approve a generic drug but not a brand name version. It may approve fewer therapy visits than requested. Reading the approval carefully matters. Appeals are part of the system. If pre-authorization is denied, the doctor can submit additional records, explain medical necessity, or request peer review. Patients may also have appeal rights under the plan. A strong appeal focuses on the policy criteria and medical facts, not only frustration. Pre-authorization affects timing. A scan needed urgently may be delayed while paperwork is reviewed. A surgery date may move because approval is pending. That waiting period can be stressful. For planned care, starting the authorization process early is often the safest practical move. Specialty medications create a lot of pre-authorization issues because they can be expensive and closely controlled. The insurer may require lab results, prior treatment history, diagnosis confirmation, or specialist involvement. The pharmacy may also need approval before dispensing the medication. Out-of-network care can complicate approval. A service may be medically approved but still processed at a higher cost because the provider is outside the network. Pre-authorization and network status are separate questions. Both should be checked before planned treatment. The worst assumption is thinking the Doctor/Euro's recommendation automatically equals insurance approval. A doctor can be medically right and the insurer can still require paperwork before paying. That gap is where many disputes begin. The safest approach is to verify the administrative step before care happens. Pre-authorization is not the most pleasant part of health insurance, but it is one of the most important to understand. Before expensive planned care, ask whether approval is required, confirm it in writing, keep the approval details, and check the network. Those steps do not remove every problem, but they reduce the chance of a denied claim after treatment. Pre-authorization is not the same as a referral. A referral may be permission from a primary doctor to see a specialist. Pre-authorization is approval from the insurer for a service or treatment. Some plans may require both. Mixing them up can leave a patient thinking everything is ready when one step is still missing. The wording in the denial letter matters. It may say the service is not medically necessary, experimental, out-of-network, missing documentation, or not covered by the plan. Each reason points to a different response. A missing record is handled differently from a policy exclusion. Doctors sometimes use peer-to-peer review. This means the treating doctor speaks with a medical reviewer from the insurer to explain why the requested care is needed. A short conversation can sometimes clarify details that forms did not capture, especially for complex cases. Patients should keep their own record of dates, names, approval numbers, and submitted documents. When a bill arrives months later, memory is not enough. A simple folder can show when approval was requested, what was approved, and who confirmed it. Pre-authorization can create emotional stress because the patient is waiting for care, not just paperwork. Pain, fear, or uncertainty may continue while forms move between offices. That is why clear communication from the provider and insurer matters. Silence makes the medical problem feel even heavier. Treat pre-authorization as part of planned care, not an afterthought. Before a costly treatment, confirm the requirement, verify the provider and facility, save the approval, and ask what costs still remain. Approval is a key step, but it is not the whole insurance answer. For example, a patient may schedule an MRI after a doctor recommends it, only to learn that the insurer wanted clinical notes first. Another patient may receive approval for one hospital but not for a different facility. These details feel administrative, but they decide whether the bill moves smoothly or becomes a dispute after care is already finished. A useful habit is to ask for the approval details before the appointment, not after the bill arrives. The name of the service, the provider, the facility, and the approval dates should all match the planned care. A single mismatch can turn an approved treatment into a billing argument.